So please welcome Häni Ashkar to the stage.
My name is Häni Ashkar, CEO and founder at Daqatra. Daqatra matches patients with native-speaking doctors. With our mobile app, they can communicate directly through chat and video call without any third parties. This means better access to healthcare, more trust in meetings, and a cost-efficient solution. We live in a constantly changing world. And we all remember the refugee crisis during 2015. More than 60 million people were displaced all over the world. And people are also relocated because of new partnerships, work, study, and other adventures in life. For all of those people who arrive to a new place, language barriers is always an obstacle. And healthcare, believe me, is not an exception. The several studies testify the consequence of patients and doctors that don't understand each other. The quality drops, multiple visits are often needed, the risk of misdiagnosis increase, and the total cost for healthcare continue to rise. And there is a lot of self-criticism within healthcare. A study held out with 3,600 Swedish doctors showed that a third of them felt that they can't offer equal healthcare for everyone. 80% of them said that specifically it is because of language barriers. Solutions to overcome linguistic barriers in healthcare have been criticized a long time. And a study with 11 of 16 Swedish counties, landsting, showed that 1 million doctor appointments was held with an interpreter participating in the meeting. 1 million. And at the same time, we have about 1,000 authorized, educated interpreters in Sweden. I mean, it's very clear. And the consequence of this is that we have a situation in Swedish healthcare where we put the patients at risk. Many of these educated interpreters in Sweden, they often take more well-paid assignments than the healthcare can offer. And the rest often lacks knowledge within the field of medicine. It's time-consuming and often also puts the patients at risk. So what do we do when we don't find the interpreter, for instance? Many patients bring family and friends to translate. And maybe the worst thing, I would say, is when their own children are placed as a bridge between their own parents and the doctor. And it's happening every day. So we launched a pilot March this year, focusing on the two biggest foreign languages in Sweden, Arabic and Farsi. We met about 100 patients, and the goal was to verify if this is a solution and about the need. And it was clear enough. There is a big need, and there's so many people here in Sweden and in Europe that feel so alone in the healthcare system. We, Daqatra, envision a world where you easily get access to healthcare and can communicate directly with a doctor. We believe that healthcare without language barriers is an obvious right, and that's why we created Daqatra. Daqatra is a mobile application that overbridges language and cultural barriers directly through chat and video call, without any interpreters, family, and friends. And it's easy. It's very easy. You sign in and choose your language. We're currently focusing on the 5 biggest languages in every market we're in. You search for your symptom and answer related questions, all to make it efficient for the doctor. And then you have the meeting through chat or video call, and our doctor can give medical advice, prescriptions, or even referrals when needed. By that, we give a totally new access to healthcare. We minimize the risk, improve the quality, we reduce the patient's returns for the same problems, we proactively reach out to those people before it's too late, and we reduce the total cost for healthcare. But I would say most importantly, we are giving access to patients to healthcare that are now understood. But for us, it isn't just about digital healthcare appointments. We want to educate people. We believe that with knowledge, we can prohibit emergency situations and even society problems in the future. That's why we're currently setting up a leading platform within our platform that with healthcare information, where you can read, listen, and watch to different healthcare topics. Since we started, we have signed a deal with a big healthcare provider in Sweden with more than 12 healthcare centers. And we also have an agreement that gives us access to healthcare subvention through a Swedish landsting. And we also proudly are part of Sahlgrenska Science Park Incubator. And soon we are launching our new platform that will give even more access to healthcare. We have taken a big step towards eliminating language barriers in healthcare. And with technology and a clear vision, we will continue to provide healthcare solutions that the patients understand. Thank you so much. And if there is any questions, anyone who wants to talk about corporations or even investment opportunities, please feel free to contact me. Thank you.
I think this is something that gets me really excited, because I work in primary care and I face this problem that you describe every day. I know I provide, well, care that isn't up to par because I can't understand the patient in front of me. Yeah. So this is really, really interesting and addressing a very real issue for a lot of healthcare providers and patients. And I think it's very typical that it's a small private company that addresses such a huge issue that exists as a problem within healthcare. Yeah. And how, I mean, have you started working together with any healthcare providers or, I mean, regions or?
Yeah, well, we have an agreement that will give us access. We are still planning. We have the pilot and we're now relaunching soon with our new platform. So that is, we will see that in the future, hopefully. And that is something we are working on, because we don't want to do that by ourselves. We think that if we can cooperate with others, we'll do so much better. We need each other, I think.
Yeah, because it's often like this. If someone comes up with a solution, it's still a bit difficult to get integrated into healthcare and actually manage to use this solution and idea. Yeah. So how are you going to move forward with this? Or do you have any ideas on how could the the hospitals in Sweden become better at using these kinds of ideas? Yeah.
I mean, I often feel that the one that makes it difficult sometimes is the politics and old mind that don't make it easy. I think all about it is courage to invite us in, to let us speak, to give us a chance to do such a thing, because there is so many e-health companies here in Sweden that have fantastic solutions. And if we can give the possibility to for every one of these companies to make what they are best in, then I think we can find the best solutions for the patients. So courage.
Courage. Yeah. It comes back to the leaders and their courage to do something different. It's a theme that runs through the day, I think. Yeah. So do you think this, I mean, the problem you're trying to address here, do you see it as a growing problem or something that we...
Yeah, I mean, we live in a global world. People are relocated everywhere. And since we were talking about the elderly care earlier, and we know that every fourth Swede will become a pensioner in the near future. And from the elderly care, we can see the tendency and experience tells us that people are falling back to own habits, but they're also falling back to their mother of tongue language. So I do think that this will be the language barrier will just stay in the healthcare for generations to come. Yeah.
And I mean, it's not only elderly. I've had the experience of meeting patients in the emergency department that have had a stroke, for instance, and then revert back to their own original language because they can no longer speak Swedish, even if they've been able to do it for the past 15 years. And I mean, being able to meet those patients in their own language and providing high quality care is really important. Yeah. I think you're onto something. I think this is really interesting. And thank you very much for coming here and presenting this.
Thank you.